Well, good morning, everyone, and welcome. Thank you for attending our first virtual celebration for Children's Environmental Health Day. We just wanted to thank you for taking your time and dealing with any trouble you may have had with the storm and weather for being with us this morning. We really appreciate it. And today we just wanted to celebrate Children's Environmental Health Day. This is a special day for all of us who are involved promoting children's environmental health, both here in our local region and across the state. Next slide. So what is Children's Environmental Health Day? For those who aren't familiar with it, it's a day of education and action on behalf of children's environmental health. And this is something that we are promoting with our partners through the New York State Children's.
Yeah, they're kind of like, they want to be involved in everything that's going on. Yeah. Oh my God, this is too... Oh my bad, it should have been...
Thank you. And we just want to recognize the importance of working with our own network and then the group from the Children's Environmental Health Day national group that have started this. Next slide. So a little bit of the overview of today's program. Just wanted to welcome everyone. We'll start with a little bit of a local perspective, and then we'll expand our scope to a more regional and statewide view of what's happening in pediatric environmental health across the state. And if you could save your questions for the end of that first session, we'll have some Q&A. Feel free to put any questions in the chat. Kate and I will be monitoring that, and we'll have some time to speak and discuss. We'll take a short break, and then we'll move on to the next segment of today's celebration, where we recognize some of those in our community who are pediatric environmental health champions. And we'll save some more time for discussion at the end before we close and wrap up. Next slide. So CEH Day was started back in 2016 by the Children's Environmental Health Network. And just as a reminder, it's celebrated on the second Thursday in October every year. This is the first time that we're celebrating it here at Albany Med. And again, it's a day of education and action on behalf of children's environmental health. It's a day that we can get together with our partners, with you, celebrate the accomplishments that we've done over the past year, and have a chance to talk about our vision for what we would like to accomplish over the next year. And for those on the call that might be from other organizations that are just learning about CEH Day for the first time, it's also a day, I think, to raise awareness about the importance of healthy environments on children's health. Some of the different ways those healthy environments could be promoted: clean air and water, healthy homes for children and families, safe food, consumer products for children and families, and generally just healthy environments for children to grow up in for their health and development. Next slide. In New York State, CEH Day is recognized as a vitally important day for children's environmental health. It was proclaimed back in October 2018 for the first time by Governor Andrew Cuomo. And this coincided with the launch of the statewide network of children's environmental health centers. On the left, you can see the legislative resolution. And if you're interested for more information about that first CEH Day event, there's a QR code that will take you to a website on the NiceCheck website that has a little bit more information and really shows how we had this all started. Next slide. And so as we gather together, I think thinking, and asking ourselves the question, well, what does CEH Day mean to us? For us at Albany Med and our center, it's a day to celebrate the progress of the movement. And it's a day that we can help support a strong network of child health advocates. All of you on the call, thanking our partners for all that you have done to improve the lives of children in the state. Next slide. And across the state, other organizations and institutions will also be celebrating CEH Day. The Nice Check Network, the New York State Children's Environmental Health Centers. This is a network of dedicated pediatric champions across the state that are working together to promote children's health and healthy environments for children. Next slide. And for those who aren't familiar with Nice Check, all the regions in the state have access to a center all the way from downstate Long Island, New York City, upstate New York, all the way out to Buffalo. And so each region is going to be doing different events. There'll be more information on how to join some of those events later in today's presentation. But really, this is a day that we can celebrate with our friends and colleagues across the state. Next slide. And just a little bit of a local perspective here in the Capital Region, some of our priorities that we've been focusing on over the last year, things like asthma care coordination for our patients. Kate Musto, who's been helping a great deal on that, has been doing a phenomenal job. Certainly the challenges of COVID-19 in our own center, doing things like transitioning from nebulizers to metered dose inhalers in the office, working with our partners at Nice Check on some virtual ways that we can reach out to patients and their families to help promote environmental health and asthma care, working with our partners to provide educational materials regarding COVID for patients, and also sustaining the work that we've previously done and want to continue to do during these challenging times with the COVID pandemic, promoting healthy homes for children and their families, and also focusing on lead poisoning and prevention. Some of our own local partners that we've been working closely with include the Albany Med General Pediatrics Group, the Asthma and Tobacco Coalition of the Capital Region, Clean and Healthy New York, recent work with the formation of a community asthma coalition with various pharmacies, both local pharmacies, regional, and some national chain pharmacies. And of course, our partners at the New York State Departments of Health and the Healthy Neighborhoods Program have been strong supporters. Next slide. Just to highlight some of the 2020 accomplishments locally, asthma care coordination. For those who haven't met Kate, you can see her photo on the right. She recently received certification as a certified asthma educator, which is a phenomenal thing for our patients. Promoting environmental health screening for our patients and partnering with others in the community to help promote resources for them. And building community partnerships through ways like the Asthma Coalition, the Tobacco Coalition, some different resources that were developed, including a vaping toolkit. The pharmacies, we've been able to serve over 1,000 children and over 7,000 adults as a result of the work together. And that work that we've been trying to promote is mainly surrounding labeling patients' asthma medications. You can see on the right, there's a little example of a green sticker that could go on their daily preventative medication. Some resources there that we've been working with Albany Med to develop for pharmacies and partnering with our Nice Check partners. There's a QR code that would take patients to the Nice Check website that has information on how to manage your child's asthma, just as some examples to highlight. Next slide. And now I want to pivot a little bit, and we'll be hearing from Clean and Healthy New York as we kind of look beyond our immediate region, beyond Albany Med. I'd like to get a little different perspective from somebody who's very much involved with child advocacy. So Bobby, I'll turn it over to you.
Great. Thanks so much, Steve. So Clean and Healthy New York is an environmental health advocacy organization, and a lot of our work has been focused around children's environmental health. And so just sort of taking a step back, the things that we look at primarily have to do with the chemicals in our environment that can contribute to or can cause a variety of health harms, including learning and developmental disabilities, as Steve has been talking about, asthma, contributing to cancer, but also contributing through hormone disruption to obesity, diabetes, and a number of other sort of hormone-related diseases and disorders. And so we work to protect children's health by taking action. So we work to make sure that we're protecting prospective parents because there's a lot of evidence that particularly for things like childhood cancer, which I'll talk about in a second in specific, children's health outcomes are affected by the environments that their parents are in before their mom gets pregnant. We also then need to make sure we're safeguarding the environments of pregnant women for the very same reason. And then that we're preventing exposures to harmful chemicals for infants and toddlers during their first 1,000 days, because there are specific critical windows of development that can, where that rapid growth and change makes babies and toddlers uniquely vulnerable to outside interference from chemicals in their environment. The next slide. So one of the things that we've been working on a national level is a new childhood cancer prevention report and an initiative. And we had some scientific researchers look at what we had strongest evidence for in the environment that are affecting the rates of childhood cancer, which has grown by about 33% since 1975. And there's really concrete evidence of connection between pesticide exposure to parents, paints and solvents, and air pollution from traffic and industry that we know are contributing to specific kinds of childhood cancer. And so, this is just one example of the ways in which we can look at how to prevent rather than simply treat or cure diseases that are affecting children every day. So this is the Childhood Cancer Prevention Initiative, just launched in September, and you can see there are a number of leading organizations across the country that are working to advance changes both in policy and the marketplace, but there's also a strong role through things like environmental health screening and other things that folks within the Nice Check network, including Albany Medical Center, can do to help moving down that path towards prevention so that kids don't develop asthma or cancer or other health problems in the first place. Next slide. So when we think about Children's Environmental Health Day, we really want to celebrate what we've accomplished, and I look forward to later in the program today talking a little bit more about what we've done together between Clean and Healthy New York and folks within Nice Check. But also that, we want to make sure that we're continuing to learn, because there's always new information connecting. There's so much we don't really understand about the role of chemicals in our environment and their impacts on children's health. So making sure that we're constantly sort of pulling in the latest information. And then really encouraging folks to think about how they can be advocates for action by working to make sure government is advancing protective policies, getting companies to change the products that they're making or the way that they're advertising, thinking about how healthcare institutions can play a critical role in that, and more, and that we really can sort of change that direction and that trend for children's health and protect them from chemicals and other things in their environment that are affecting their health. Thanks, Steve.
Thank you, Bobby. All right, thank you. And I just wanted to welcome Dr. Maida Galvez and Dr. Perry Sheffield to today's celebration. Welcome, Maida. Welcome, Perry. Can you guys hear me okay?
Yes.
Okay, awesome. Good morning.
Good morning.
And just give the audience a chance to hear a little bit about a more statewide perspective, what's going on across the state in terms of children's environmental health. If you wouldn't mind, Maida and Perry, giving us an update on how things are going across the state, we'd appreciate that.
Yeah, happy to. And we're just so thrilled to join you all in the Capital Region. And it's been pretty amazing to witness the work that's being done there and how it's really meaningfully grown in the last 3 years. So we just want to say kudos to you, Steve, and the partnerships and the interdisciplinary team that you're working together with to really meaningfully address families' needs when it comes to healthy homes and healthy environments. It's been awesome to witness. So, with that, Perry and I will get started. We're the co-directors of the Coordinating Center for the first publicly funded statewide network of children's environmental health centers in the country. Let's see, can you get to the next slide? This is our crew, who we love dearly. And every time we show this community and how we have expertise across the state, it gives us hope that we could be a model for other states and that this will be one of many networks to come. Next slide, please. And so we're going to give you a little bit of some of our accomplishments over the past 3 years. And so we've educated over 34,000 families and community members. Next slide.
We've provided environmental health services, and we'll say a little bit more about what that is and especially what that looks like now to over 12,000 families. Next slide. We've taught over 13,500 healthcare professionals.
We've educated almost 500 healthcare trainees and hosted over 700 participant hours on ECHOs, which are case-based and didactic discussions about children's environmental health concerns.
And we have realized that we are standing on the shoulders of giants throughout this. And we have tried to honor the legends, like we see here, Ruth Lawrence of Rochester, who has reluctantly retired. He's a nonagenarian who's been practicing and was the first leader of our Rochester Center. We've also implemented, when we were able to gather in person, we implemented our fireside chats, which is an opportunity to bring together pediatric heroes, pediatric environmental health heroes, to have casual conversations to really try to understand behind the scenes of what they have done. And we've also gotten to honor children's environmental health champions, both community-based organization, representatives, parents, and our government allies in this work.
And one of the things that we're most proud of is training the next generation of leaders. And here at Scholars, from our first cohort of scholars, and we're really excited that Albany, come November, we'll have an Scholar who's on the call now and hosting, Caitlin Winslow. Next slide. And what we've seen in our experience, both Perry and I are past fellows, is that it really positions the next generation of leadership. And here's Lauren Zajac, our colleague, now our clinical director, stepping into a national leadership role for the American Academy of Pediatrics Council on Environmental Health, joined by Phil Landrigan and Sophie Bach.
And we only really move things forward when we work together. And this is a picture from the Just Green Coalition, who works so closely together to push forward the Child Safe Product Act. And it is with these partnerships that we really feel effective. And also able to respond. You all might remember last fall, vaping and the sudden acute illness that was affecting adolescents was seemingly the big public health issue. Perhaps we thought it was going to be the big public health issue of the year. And our network was able to mobilize and inform and advocate. And then similarly, as we'll talk about in just a minute, we've done some rapid pivoting under COVID to do the same thing.
And here's a picture of our first ever Children's Environmental Health, our celebration last year, actually, our second Children's Environmental Health Day celebration. And it's even more special when we join you remotely to see all of us together, and how meaningful it is when we can join as a community. And to be together again in this format has allowed us to expand our reach to join you for your celebration, and in many ways achieve something that's even better. So thank you all, Stephen, Bobby, Caitlin, for inviting us to join you. And it's through this network that we're able to have any semblance of reach across the state. And that virtual format that we've all reluctantly moved to, is so critical these days. And that's why our website, our social media presence, is critically important to making sure that families get the information that they need as they navigate this world in the time of COVID. So if you need information about healthy homes and green cleaning and safe disinfectant, you can find it on our website. And it's had tremendous reach. You can sort of see our social impressions have reached nearly 70,000. And this encompasses our entire state. So it's cities and towns reached via the website is over 226. Next slide.
And here's a visual of that reach. People, we can tell from some of our metrics of our online presence that people from around the state are accessing our materials, and we want to grow this. And if you, as a listener, are having ideas about how this reach could be further expanded, we are open to hearing that. So feel free to reach out to us in New York City, or to the Albany Center, or to whoever is your closest center.
And here are the prescriptions for prevention that I mentioned that are located on our website. The COVID specific prescriptions are available in multiple languages: Arabic, Bengali, Chinese, French, Haitian Creole, Korean, Russian, Spanish, and Urdu. And please feel free to take them. I know Albany has been working on tailoring them to refer them to local resources, families to local resources. And then we have a wider array of prescriptions for prevention that are available both in English and in Spanish. They're meant to screen, counsel, and refer families to local interventions.
So I mentioned that we pride ourselves on rapid action, and also that we have worked hard to provide environmental health services directly to patients and families. And so here is an example of how we are pivoting to do that virtually and still provide a suite of resources, tools, counseling around asthma education, identifying in-home environmental asthma triggers, talking about simple steps that are within reach for families to do to improve their in-home environments, and then critically connecting families to community-based resources. Part of the challenge of addressing environmental health problems is that there's not a pharmaceutical prescription that you can write for a family, but often the prescriptions that we write and these prescriptions for prevention that we are developing on around many topics are to get those resources to the families that are needed, to connect them to the local, often community-based organizations that can provide those. And so there's a toolkit, a whole suite of materials that we are using in our services. Some of those are the prescriptions for prevention. Here you see one focused on safer pest control. We know while pests can be a trigger for asthma, we also know that sometimes the remedy is worse than the problem. But there are safer ways to control pests. We also know that proper use of spacers is also really important in having the medication be as effective as possible. And then greener, safer cleaning practices to, again, not inadvertently expose children to chemicals when you're trying to reduce other exposures that could make asthma worse. And then working with families on asthma action plans.
To accomplish all this work, it truly takes a village, from the children's hospitals that lead our partner centers to our community partners who are really frontline in helping us to understand the needs of frontline communities. We can't thank you enough, and particularly the New York State Department of Health for prioritizing the need for expertise in children's environmental health across the state and setting an example for the rest of the country. I think COVID has shown a light on the critical importance of healthy environments for all families, whether it's healthy homes, healthy schools, or healthy communities. And the urgent work that's needed to address the wide array of disparities in all those areas that disproportionately burden certain communities. And I'm so proud that this network is trying to right some of those wrongs and working together with families to see if we can achieve the change that we need and want to see for all families across New York State. Thank you.
I know there's more to come in this program today, hosted by Albany, but if you scan this QR code with your phone camera, you'll be taken to an evaluation link. We would, as I mentioned, we love input about how we could do what we're trying to do better. And so feel free to go to this, the link that you either see at the bottom left of the screen or scan this code to provide that input to us. We appreciate it. Turn it back over to you, Stephen. Thank you.
Thank you, Perry. Thank you, Maida. You know, we're a little bit ahead of schedule today, which is great. And I just wanted to see if the audience had any questions or could maybe even share their perspective on what Children's Environmental Health Day would mean to you if you're an individual or even your organization, if you're joining us today representing an organization. So I just wanted to ask the audience if anyone had any thoughts on sharing, you know, what the significance of today means for them.
This is Kevin Jobin Davis from the Healthy Capital District Initiative. Here, let me start my video. And I just want to offer that that I'm really happy to have you folks active in this space and encouraging and pulling us forward in it, because environmental issues are kind of long-term public health issues, and they are highly impactful on the population, but it can be hard to work on it with individuals or with institutions because it takes such kind of persistent attention, and it really does take a coalition of organizations to show that commitment and value that this needs to be addressed. But it does take some rallying point in order to bring this about. And there are many issues. You know, we in the Capital Region have had PFOA issues or burning of chemicals in incineration plants, and trains, and certainly housing, trains, highway issues that have impacted respiratory health. And there are many more, but it really does take a point organization to help pull us together. So I really appreciate your commitment, but also your leadership in a mechanism through which we might organize and focus more on environmental health rather than individual health.
Those are great thoughts. Thank you, Kevin, for sharing. I certainly appreciate, having, even just regular meetings, with our Asthma Coalition, Asthma and Tobacco Coalition. It's always interesting to just have opportunities to meet others that are, just as passionate, as you are, in the area of environmental health, and really looking for ways, that you can support each other. helping out. It's been really helpful for us. And, again, thank you, Maida and Perry, just for all your help, leading us, through the Nice Check network. Miss you guys. I'm sorry we couldn't, be present together in person, but I guess this is the next best thing. Any other questions or comments from anyone else in the audience?
Hi, Steve. It's Nancy Lerner from Cornell Cooperative Extension.
Good morning, Nancy. Welcome.
I'm on video now. Just want to say kudos to the past presenters and definitely yourself and Caitlin for involving us in this effort. You're going to hear about the Healthy Neighborhoods program, I think in the next half hour or so. And I just want to say, if there's anything we can do to, add to your efforts, continue this, try to improve children's, definitely children's, but all residents' environmental health, we're more than willing, okay? And I also want to mention, I didn't realize that this effort was statewide. So there are other healthy neighborhood programs across the state. So if for some reason you want to connect with them, I could definitely send you a contact list if you don't have that already. And again, we're not going into homes now, but we are doing virtual assessments, and we do have access to probably, I don't know, on an annual basis, 1,300 households, maybe 1,500 households. So that translates into probably at least 3,000 individuals, adults. So we're more than willing to get a special message out there if you need it.
Thank you, Nancy. Good to hear from you. Maida and Perry, just with your perspective, from like a statewide perspective, do you feel like, looking ahead, maybe over the next year, 5 years, are there ways that we can, both as centers, as organizations, as individuals, as we celebrate today, ways that we could work, better together for growth, or areas that you feel like, we might be wanting to focus more attention to really help promote children's environmental health?
So happy to start, and then I'll pass it over to Perry. But I think that really the key to even beginning to be successful at this work is partnerships and community building. And I'm already impressed by who's on the line here with you today, Stephen. And it's wonderful to meet you, Nancy, and Kevin, and others who are on the line, because I see how you've already grown this community. And that's phenomenal. And that's at the core of what we need to build capacity to even address environmental health locally, regionally, and nationally. And I think the work that you're doing is really a model. It's amazing. And so I think, our ability to, one, know each other, break down silos, work in different fields and expertise, and bring them together all with one shared mission is the building block of success. So kudos. And I'll turn it over to Perry if she has any additional thoughts.
I was having a very similar thought that, we keep these efforts going through writing proposals and grants and things like that. And we're often talking about the health outcomes that we're looking toward, and sometimes even the process metrics about how we do this. But at the end of the day, it really comes down to the relationships, and that we are all charting new territory and what that looks like and how we're even able to build those relationships in this COVID era. And it makes this network even more precious and important to us, to me, and this work, because as Maida just observed, there's already this beautiful blossoming network in Albany that we at the coordinating center in New York City are just becoming privy to, and that's fantastic.
Thank you, guys. All right. Kate, any questions from anyone in the chat?
Nope, nothing so far.
Okay. Well, why don't we go ahead to the next slide? We're a little ahead of schedule. Normally, we were thinking of taking a 5-minute break, but unless people feel strongly, I think we could maybe just continue and keep the momentum going and maybe try to wrap up closer to 11 as opposed to 12, if that works for people. All right. I wish I could give you all coffee or a snack, but it'll have to be virtual. All right, next slide, Kate. All right, so for the second half of today's program, we really want to recognize outstanding work promoting pediatric environmental health. And so starting for the first time, our center is going to recognize some of our partners and individuals who have done this work. And really, we are recognizing today as environmental health champions. So the 2020 CEHC Champion Awards today are going to be going to several organizations. And just for those on the line that don't know who they are, just kind of what we'll do is we'll give you a little bit of background about each organization. And then for the organizations that are on the line, we'll give them a chance to talk a little bit about what they've been doing and how working together as part of this network has had an impact on their organization, and just give them a chance to speak. So we're going to be recognizing the Community Asthma Pharmacy Coalition, a specific individual, a pharmacist, Clean and Healthy New York, the Healthy Capital District Initiative, and the New York State Department of Health Healthy Neighborhoods Programs. Next slide. So to give people a little bit of background about the Pharmacy Asthma Coalition, this is a very informal coalition of partners. As I said earlier, Albany Med, one of our major managed care organizations in the area, CDPHP. We have a local College of Pharmacy, Albany College of Pharmacy and Health Sciences, and then a mix of some local pharmacies like Lincoln Pharmacy, some regional pharmacies, Price Chopper being one, and then some national brand pharmacies with several pharmacies here in the area, such as Walmart and CVS. Another local one is Four Corners in my own town in Delmar, New York. And so we've been meeting together for the last 2 years to kind of work on the idea of promoting pediatric asthma medication labeling, so actually putting a label on a patient's inhaler, and promoting better asthma education from the perspective of a pharmacy and a pharmacist. Next slide. And currently, we've had to scale back a little bit because of COVID. We were up to 20 pharmacies, and now we're at least at 10, a little bit more than that are going strong. And really providing this coalition with the support, currently providing the actual stickers, some educational materials, and as we celebrate today, we've had opportunity with other partners through NiceCheck, specifically the Long Island group, and working there, they've been able to work with their local legislators to promote education in pharmacies, creating things like an asthma educational poster for patients and families. And that's something that we've been able to partner with and work on together. And so really the program, I think, just works the way it does because we support each other. I think the more we listen and understand each other and seek to understand what it's like for the struggles and challenges that people are facing, like pharmacists, we realize, or at least I've realized, that there's a lot of similarity. We're being held to similar measures for our patients, making sure they're taking their medications on a regular basis and really being there to support each other. You can see on the right an example of what one of those medications would look like if it's labeled with our red rescue label. Next slide. From a pediatrician's perspective, I can't tell you enough how confusing it is for families. Day in, day out, we see patients here for asthma follow-up visits, asthma management. And this poster just shows the multitude of asthma medications that are prescribed. And it's so easily confusing for families, which medication they should be taking on a daily basis, to control or prevent their child's asthma from acting up, and distinguishing that from a rescue medication. So if they are having trouble breathing, taking this. So it's certainly a challenge for us. And this is a great resource from the Allergy and Asthma Network. It's a medication poster that a lot of us have in our offices just to help, promote education for families. But this sort of shows you the problem, the challenge that is facing a lot of these families. Next slide. So to give you some idea for the success of this program, and you can see on the left, as we've been getting feedback from these pharmacies, just in this year alone, you could see that we've had our coalition label over 2,000 controller medications, and slightly under that, rescue medications for families just in the first quarter of 2020. We've certainly faced, challenges in all of our organizations with COVID, and you can see how some of that reflects, I think, COVID coming through the area. But I think it also shows how, we are still making a concerted effort to promote this, and we're not giving up. Next slide. And so in addition to labeling medication, providing education for families is so critical. And so you can see that our pharmacy partners have provided asthma action plans for families, and that has been a tremendous thing to see. And on the right, that's an example of one of our educational materials for pharmacies with an example of the green Use Every Day label for patients. So I think, really trying to promote the idea for our families that, in addition to their primary care physician, provider, medical office, using the pharmacies as a means to provide excellent education for families, is so critical and something that we're really trying to promote as a coalition. Next slide. All right, and so here we go. So our first award is going to be going to Dan Malone from Price Chopper Pharmacy. So we want to especially recognize Dan and Price Chopper Pharmacies for the work they've been doing, really being there all the time to promote this coalition, promoting asthma inhaler labeling and education for patients of all ages in the Capital Region. Recognizing our coalition would not have the strength it currently does without their support. So today, Albany Med would like to recognize you, Dan, of Price Chopper Pharmacy for the work that you've done in promoting children's environmental health and being a children's environmental health champion. Thank you, Dan. We'd all be clapping for you, but it's virtual, so. And we'll be mailing these certificates out to you. My chair, Dr. Ostroff, and I have signed them, so they're officially coming to you from Albany Med. Thank you. All right, next slide. Oh, I'm sorry, before we move on, Kim, I think you're here on the line from Price Chopper. Do you have any words or thoughts, Kim, that you would like to share for the group?
Yes, thank you, Dr. DeWall. I am Kim DeMagistris, Clinical Pharmacy Manager for Price Chopper, and I will be accepting this on behalf of Dan Malone. We'll be presenting it to him and taking a picture. We're really happy to participate in this program, and we really recognize the value of that consistent counseling. Every time when a patient comes in and they have an inhaler, we are reinforcing which inhalers rescue and which ones use every day. And we're receiving good feedback on that. Of course, some patients like to just be on their way and they don't like to have some of that extra counseling, and they may not like us to open the packages and actually label the inhaler, but the vast majority of the patients are really appreciative, and they find it to be valuable. So, we're very happy to participate, and I just want to say thank you to Dr. DeWall and the rest of the team for including us. Thank you.
You're welcome, Kate. Thank you for joining us. All right. Thank you, Kate. Next, we would like to recognize Clean and Healthy New York. So just to give the group an introduction to Clean and Healthy, Clean and Healthy New York has been a steadfast partner of our center since we began the work together in 2018. And their mission is to advance policy and market changes to promote safer chemicals, a sustainable economy, and a healthier world. And really over the last 2 years, their organization has helped promote statewide advocacy, environmental health, educational materials such as their Getting Ready for Baby campaign and Healthy Crib and Mattress Support. Locally, in my domain, led advocacy training for the pediatric residents at Albany Med. And so many families and children and other organizations have benefited from their tireless efforts. So really today, Albany Med recognizes the team at Clean and Healthy New York for being environmental health champions. So thank you, Bobby. I think Kathy's on the line. Thank you, Kathy. Greg and everyone else at your organization. Just want to give you guys a little bit of time to talk if you have any thoughts or words you'd like to share with the group.
Kathy, if you're talking, you're on mute because Kathy was going to be speaking for us. Just want to give her a second. Sorry. Well, she's lost internet with the storm last night, so I apologize for the technical difficulties. So I'm Bobby Wilding. I'm Deputy Director at Clean and Healthy New York, and we have just been so excited by the work not only of Albany Medical Center, but of the whole broad.
Can you hear me now, Bobby?
Oh, yes, there you are.
Can you hear me now?
Yes.
Oh, okay.
Yep.
There you go. Take it away.
I pressed *6 and it unmuted me, so that was magical. And thank you, Bobby, for saying what I was going to say about having no internet, et cetera. And thank you so much, Dr. DeWall, for this award. It's unexpected, and we certainly don't do the work that we do for any recognition or kudos or at all. And so it's always wonderful to be noticed in that fashion. Thank you so much. And I just wanted to talk about how ingrained children's environmental health is into Clean and Healthy New York's DNA. We've worked on lead poisoning prevention. We worked to get this huge omnibus bill with the help from the Children's Environmental Health Centers, the Child Safe Products Act passed. We've gotten chlorinated tris, which is a carcinogen, out of baby products, the 0 to 3-year-old market. Banned bisphenol A in baby bottles and sippy cups, and others too numerous to name. But our focus all along has been on children's environmental health. So this is a wonderful partnership, and we also work on budget items and worked with Dr. Landrigan and Galvez to establish secure funding for the Children's Environmental Health Centers, which are a visionary program, and I look forward to seeing it be transformative over, the years as it grows and flourishes. And, it's great to be serving on the advisory council for that. And also, we love being a community partner with AMC. We love supporting each other's across social media platforms and leveraging built-in calendar opportunities for communications like Lead Poisoning Prevention Week and children's cancer and all of the things that are already in the calendar that we leverage. And we love doing advocacy trainings for, for residents. It's always wonderful to see the transformation that occurs, and we love to see them put those newfound skills into effect in a very meaningful way. There's nothing more powerful in the halls of power than to be able to say, as a pediatrician, etc. And they're extremely resonant spokespeople. So I could go on and on, but I just want to thank you again on behalf of everyone at Clean and Healthy New York for this recognition. It's very meaningful to us. Thank you.
Thank you, Kathy. Thank you, Bobby. All right, next we have the Healthy Capital District Initiative. So to give people a little bit of background about this organization, HCDI works to increase access to coverage, provides health planning expertise, and supports health prevention programs across the Capital Region. And they have tirelessly led our region's Asthma and Tobacco Coalition and serve as a catalyst for connections between organizations in our region. Some specific examples: in 2020, they were a tremendous help in promoting tobacco cessation programs and helped create a vaping toolkit for our region. So today, Albany Med would like to recognize the Healthy Capital District Initiative for being Children's Environmental Health Champions. Congratulations and thank you.
Thank you, Dr. Dewall. This is Kevin Davis. I'm the Executive Director of HCDI, and it's always great to have medical partners in the public health work. That we're all important pieces to the puzzle. And I think particularly for asthma, in the Capital Region, children in 4 of the Capital Region counties, or 4 of the Capital Region counties are in the highest quartile of asthma rates in the 11. I haven't said this well. So for the worst quartile of asthma rates in the state, the Capital Region has 4 quartiles when it comes to children's asthma. And for adult asthma, 5 of the counties are in the worst quartile. And certainly this relates to socioeconomic status and race, but also children have asthma emergency department rates a third higher than adults. So we're really happy to work with you and other partners like the Healthy Neighborhoods program, who recognize that children's asthma care and asthma care in general is not just about treating sick patients, but sick buildings. Houses that are old are more susceptible to pest control issues and accumulated waste. Wood stoves or kerosene stoves or mold are particularly impactful on asthma exacerbations. And while medical support and engagement is important to people's asthma care, that environmental health is critical to improving their outcomes. Recognizing that, we developed a asthma screening process and self-management guide that we use when we help over 10,000 people a year get public health insurance. So we incorporate that into our screening process, and now we support other organizations with that process as well. And we've been working with the center to expand that beyond our insurance enrollment program into our school-based dental program, where we serve 3,600 kids a year, and about 900 of them have asthma. And so we're trying to bake that into that process as well. So this type of collaboration is what is going to make each of our efforts to work with schools and children go better as we learn what works well for patients and families, and build on the knowledge and resources that we each can bring to the table. So thank you for your support and recognition of the value of this work.
Thank you, Kevin, and give our thanks also to Shelby. We appreciate her work in coordinating all the meetings, definitely, and all the emails. All right, and then last, we wanted to take some time to recognize the Healthy Neighborhoods program, and really with Healthy Neighborhoods, the work that the County Department of Health, each of them are doing, promoting things for healthy home environments for our families, such as like lead poisoning and prevention efforts. But for those who aren't familiar with the Healthy Neighborhoods program, they seek to reduce the burden of housing-related illness and injury through a holistic healthy homes approach. And the program provides in-home assessments and interventions for asthma, tobacco cessation, indoor air quality, lead, fire safety, and other environmental health hazards in communities throughout New York. As Nancy said, they're across New York State, and I believe there's currently 18 counties and New York City which are currently funded to provide these services to residents. Just some stories, from our own office. I remember when they had come to our office one time just to meet our group of physicians, because we like to host, different groups in the community just to learn a little bit more about them. And when they came the one time, they brought with them all their goodies and supplies that they give to families. It was overwhelming. And just to share a little bit, of some of the importance, I remember one particular family that we had referred to, and when they had gone to the home, they found that this family had no smoke detectors. And so, clearly there was a big, fire safety issue for this family. They were able to provide them with, their needed carbon monoxide and smoke detectors, other supplies that they needed, for a healthy home. So I'm really doing a tremendous job for our families in the area. We've been working closely with them to promote environmental health screening. Really, if we identify a patient or family in the office, that's in need of some environmental help, we will make a referral to their organization, and we've worked on ways to incorporate that, bake that in, if you will, to our electronic health record, and making it very accessible for the other physicians, including our residents in the office. Last year alone, we screened about 256 families and referred about 73 children to their program for environmental health services. And just for those from the DOH that might be on, I'm speaking today on behalf also of my partner and colleague, Dr. Karen Schottlerthal, who helps lead our regional lead resource center in partnership with our colleagues at SUNY Upstate Medical University in Syracuse. So we just want to again thank the Department of Health for their work on lead poisoning and prevention. Nancy, I'll turn it over to you, and if there's any other Healthy Neighborhoods programs on the line, I will turn it over to them just to give some of their thoughts or comments. And if you want to share with us, that would be great.
Thank you very much, Steve. And for the behind the scenes, and I think you know this, we refer to you as Dr. Steve when we talk about your office. We always talk about good Dr. Steve. So thank you very much. We really not only enjoy, but we feel that we're effective working with Albany Med, and we'd like to not only continue, but see how we can increase our efforts. Again, anyone on the line, if you want to know more about the Healthy Neighborhoods program, we have one of the educators, Katie. I just asked her to say a few words about how the Healthy Neighborhoods program works. Again, we're not going into homes right now, but we do virtual visits, and we do drop the needed supplies or products that they need. I have some ideas on how we can continue to work together, possibly connect you with Cornell's IPM program, Integrated Pest Management. I think that is very significant, or could be very helpful in terms of asthma control in the home, and some other ideas on how we can continue to work together. So thank you. And Katie, if you could just say a few words about the Healthy Neighborhoods program, that would be great.
Yeah, sure. Thank you for the introduction, Nancy and Dr. Steve. You basically hit all the points of the program, so thank you for that. But I'm just going to go over like a brief overview of what happens when we do get the referral from your office. So we do get the referral from the entity, and then we contact the client over the phone and make sure they have time to do the home health assessment. We gauge their needs. We ask questions to see what they do need for educational and supply wise. We do hand out carbon monoxide and smoke detectors if needed, and also fire extinguishers with the education on how to use it as well. We hand out cleaning supplies and try to encourage baking soda and vinegar for cleaning, especially for asthmatics. We talk about triggers, we identify them, and talk about how to reduce them in the home. We also give out child safety products, so doorknob covers, safety straps, shock stops, anything that would be needed in a home for a small child for safety reasons. And we do make referrals to the health department for further asthmacation from a certified asthma educator, and for free lead inspection as well if there's chipping or peeling paint in the home. We do have access to an interpretation line that I have been using, and it's very successful. So if you have any clients that are non-English speaking, we do have the interpretation line for our use. I think I hit everything. Nancy, anything else?
No, I just want to add that if there's no income eligibility requirement for the Healthy Neighborhoods program, so we don't ask about income. We do ask about insurance, because we try to connect them to an entity like HCDI if they're uninsured or underinsured, but we do not ask for their, any personal financial information. We do not ask for. And the only other thing I want to mention is we are working with a group of entities in the capital region to do some repairs. For example, if there's mold in the house, which we come across, I would say, I don't know, Katie, 3/4 of the homes, if not greater. If there is mold in the home because of, let's say, a leaky roof, we are exploring, and we might have some funds to actually fix the roof. So I will definitely let you know about that. Keep everyone posted. But we are trying to really go that extra mile and fix the repair, so people can live healthier.
Thank you, Nancy, and thank you, Katie. It's good to see you guys and hear from you. And Kate and I will definitely be reaching out to you guys to follow up and talk more. Just to continue the work that we're doing together. And just appreciate you guys so much. It's so critical for our patients and families, especially for those with asthma. This stuff that you're doing can be as or more effective than medication in their case. So thank you again. Appreciate it.
Thank you.
All right. And we will recognize not only the Rensselaer and Albany, but the other Healthy Neighborhoods programs, Columbia and Schenectady County, just for their work. So thank you, guys. Okay. Again, we're ahead of schedule. We just wanted to give some time. If anyone has questions, maybe even for any of these organizations or ideas that have come up, hearing a little bit more about their work. Any questions from anyone in the audience?
Dr. Dwell, this is Kathy. I have a question. What's the best way for us to all be connected to one another? Is there a way to share contact information, or after Children's Environmental Health Day? How can we, work more closely and more effectively with the other groups that you're recognizing today? I guess would be my question.
Kate and I would be glad to share, contact information, maybe, just compiling a resource list together of sort of environmental health resources, for the capital region. And I think everyone's official contact information at least. And then, maybe we could just double check and make sure, the emails and everything are fine for people to share. But I think, Kate and I could do that for you, Kathy.
Okay, I don't want to give you things to do. You already have a million things to do, but in yours and Kate's intimate spare time, if I think that might pay off in good dividends in the long run, potentially.
Yeah, this is Maida. I want to echo that. I agree with you, Kathy, that I think it's phenomenal, everybody that you've brought together and figuring out opportunities to continue the conversations and meaningfully grow this community and the partnerships, even amongst the folks that are on the call today, it would be fantastic. Something that we do at Sinai, and it's through a completely separate funding mechanism. It's through our National Institute of Environmental Health Sciences Community Engagement Corps. Is we have a stakeholder advisory board where questions, concerns can come in to this diverse body with really different disciplines. And together we brainstorm and work through innovative solutions that include things like community science tools and really taking research to action. And you're really doing that already, Steve. It's kind of amazing to sort of see how in 3 years you've really launched this there. That stakeholder advisory board, I'm happy to share more information with you all about like the composition, and it meets quarterly, and new people come in and out all the time. But it's an amazing opportunity to sort of keep people up to date on the work that's happening and how we can continue to work together to address some of these concerns.
Yeah, that's a fantastic idea, Maida, and it could be something that we help out with. If that would be something helpful for you, Kathy, maybe hosting some larger group meetings like we're doing today, not just for Children's Environmental Health Day, but just Children's Environmental Health, and periodically hear what's going on in our region from different perspectives.
Yeah, because I learned a lot today. And I'm, hungry for more. Keep it going. Well, thank you.
Oh, you're welcome. Those are great thoughts. Anyone else? Any other questions or any questions in the chat, Kate?
No questions in the chat.
Okay. Well, I like that idea of getting together and just hearing more. So we could definitely discuss that, and we'd be interested, Maida, to hear a little bit more from you. Maybe talking about that in greater detail. Let's see, Kate, would you like to take us to the next slide? Okay, so we certainly want people to continue celebrating Children's Environmental Health Day, and there's definitely activities out there. So what you can do, you can scan this QR code. It'll take you to some of the activities listed from the Children's Environmental Health Network, and they also have a Twitter chat. Next slide. We're also posting, this information on our social media. So Kate, along with several of our medical students and Clean and Healthy, have been helping us really promote our social media. So we're currently on Facebook at amc.cehc. and then Instagram and Twitter at Albany Med Check Children's Environmental Health Centers. So if you're not already, please consider following us. And we'll definitely have more information, about children's environmental health coming out. So thank you. And we couldn't do today's event without the help and support of Nice Check, the Children's Environmental Health Network, of course, and just recognizing my own department with the Children's Hospital at Albany Med for the support that they give. And we really want to thank you all, our partners, really just having time today to thank you for all the help you've been to us, for the work that you are doing. And I'm very excited to just continue to work with you guys as we move forward in the challenges that we're facing in 2020 and beyond, and really just promoting children's environmental health. So thank you again for joining us. Next slide. And just some special thanks, just recognizing the work that the Albany Med Pediatric Asthma QI team and their members have done. Sarah Rindinello from our Community Development Department for helping us with some of these materials, including the certificates. Our chair, Barbara Ostroff, for her support. And some of our medical students have been helping Kate and I on social media. So Sahar and Aishwarya, thank you for your help. And that is the end of the meeting. We do have another QR code. So if you don't mind, if you could, before you leave, just scan this code. It'll give us some feedback about the overall event today, and just give us some ideas for planning for future events like this in the future. And that's it. So I hope you all have a wonderful day and continue to celebrate Children's Environmental Health Day wherever you are. Thank you.
Thank you. Thank you so much.
Thanks so much.
Talk to you soon.
All right. And then we'll have materials available if anyone needs more resources. So feel free to email Kate or I, and we can help out. So we'll see you guys later.